Yeah. All right. So my name's Ashley. I am going to be doing a full assessment today, and today is August the 29th. We're going to start by using some hand sanitizer. Okay, and now let's begin. So we're going to start off with her skin. Her skin is warm, dry, and intact without any sort of bruises, rashes, edema, nevi, lesions, or scarring. Her skin color is expected for her ethnicity. Her skin turgor is appropriate. Her head is normal, subvellate, symmetric, and midline. Her scalp has no masses, infestations, lesions, depressions, or tenderness. Her temporal arteries and tenderness. So no temporal artery tenderness. We'll now do her lymph nodes, preauricle, postauricle, tonsillar, anterior cervical, posterior cervical, submandibular, submental, supraclavicular, and occipital. No lymphadenopathy or tenderness noted. We're now going to do her cranial nerve 5, which is a trigeminal nerve. We'll have you open and close your jaw, now clench your jaw. Okay, any tenderness. So, no temporal mandibular joint crepitus, subluxation, or tenderness noted. I'm now going to have you close your eyes. Every time you feel me touch, say now. Now, now, now. Okay, now. So cranial nerve 5, the trigeminal nerve is intact. Cranial nerve 7, the facial nerve is next. So smile, frown, puff out your cheeks, puff your lips, raise your eyebrows. Cranial nerve 7, the facial nerve is intact. We will now do her ears. Her ears are symmetric bilaterally without any sort of deformities. There's no masses, tenderness noted to the tragus or pinna on palpation. We're now going to assess the auditory canal and the tympanic membrane. The tympanic membrane is a pearly gray translucent color in a neutral position, kind of lights present bilaterally. There's no, there was no redness or discharge noted. We're now going to do the hearing test for cranial nerve 8, which is the auditory nerve. We'll start off with the whisper test. So I'm first going to have you occlude one ear, and I'm going to whisper a word to you. Apple. Okay, now the other ear. Apple. Okay, so she passes the whisper test. We're now doing the Weber test. Can you hear this equally in both ears? Equally. Okay, and then now we're going to do, so she passes the Weber test because there's no lateralization reported. We're now doing the Ren test. Tell me when you can no longer hear this. Now. Now. Okay, and then on the other side. Okay, so air conduction was greater than bone conduction, indicating that the Ren test is passed, and so cranial nerve 8 is intact. We will now do her eyes. Her eyes are symmetric bilaterally. The eyelashes extend away from the eye. The eyebrows extend beyond the eye. Palpable fissures are normal. Her sclera is white. The conjunctiva is pink. There's no discharge or lesions noted. We're now going to do cranial nerve 2, which is the oculomotor nerve. No, cranial nerve 2, which is the optic nerve. And to test that, we're going to do visual acuity. So starting off, we have the Snellen eye chart right below the camera. And so if you could close one eye, there you go, and then read the small sign you can read. E, D, F, C, Z, P. Okay, and now with the other eye, E, D, F, C, Z, P. Okay, and so 20/20 vision. So now we will test the other part of cranial nerve 2, which is going to be the confrontation test. If you can close one eye, and then using your peripheral vision, tell me how many fingers I'm holding up. 2, 1, and then 2, 1. Okay, and then the other side, 2, 1, 2, 1. Okay, so she passes the confrontation test, so cranial nerve 2 is intact. Next is cranial nerve 3, which is oculomotor nerve. Cranial nerve 3, wait, that's cranial nerve 3. Cranial nerve 4, which is the trochlear nerve, and then cranial nerve 6, which is the abducens nerve. We'll start off with, it's going to be the extraocular movements of the eye. So if you'll follow my pen, and we're going to take her through the 6 cardinal fields of gaze. So her gaze is She has a conjugate gaze through all 6 cardinal fields of view, indicating cranial nerve 3, 4, and 6 are intact. We'll further assess cranial nerve 3 by doing pupillary response to light, and her pupils are responding both directly and consensually to light. We're now going to do convergence, so if you'll just watch this. Okay, so her eyes converged appropriately. Now accommodation, look at my pin light, now look at the wall, pin light, now back the wall. Okay, so her pupils constricted appropriately, indicating that the accommodation is that she passes that test, and so cranial nerve 3 is intact. We will now do the red reflex. Okay, so red reflex is noted, and the fundus is free of any lesions. We're now going to do her mouth, nose. Now we're going to do her nose. Her nose is midline, symmetric, straight. I'm going to have you close one side of your nose and breathe in and out. Now the other side. She has nasal patency. We'll now have you close your eyes. We're testing cranial nerve 1, the ocular olfactory nerve. Cranial nerve 1, the olfactory nerve. So I'm going to have you let me know when you can smell alcohol. Yeah. Yeah. Okay. So cranial nerve 1, the olfactory nerve is intact. We'll now look at her lips. Her lips are smooth and pink and moist. I'm gonna have you open your mouth. Okay, and then I'm gonna have you stick your tongue out, raise your tongue, move your tongue side to side, say ah. Perfect. So her posterior pharynx, her palate, the floor of her mouth, the mucosa, the gums are all, and the tongue are all smooth, moist, and pink. The salivary glands are not swollen. Her teeth are aligned without any sort of dental decay. Her soft palate rises symmetrically, and the uvula stays midline with phonation, indicating cranial nerve 9, which is the glossopharyngeal nerve, and cranial nerve 10, which is the vagus nerve, are intact. And then her tongue moves side to side with ease without any sort of fasciculations, indicating that cranial nerve 12, which is the hypoglossal nerve, is intact. We will now do cervical spine. So now I'm going to have you inflection, look down, back up, extension, all the way back, hyperextension and lateral flexion. There you go, and then rotation. Perfect. So full range of motion of the cervical spine. I'm now going to palpate the trachea. It's midline. It's not deviated. And now I'm going to palpate. I'm going to let you flex forward your head, palpating the thyroid, and you can look back up. And it's non-fibrotic without any nodules or swelling noted. I'm now going to palpate the carotid arteries one at a time. Okay, bilateral symmetrical pulsations. And now I'm auscultating with the bell for any sort of bruise. No bruise noted. I'm now doing the chest. Her chest is both anteriorly and posteriorly symmetric without any signs or symptoms of respiratory distress, such as like retraction, cyanosis, accessory muscle use, tachypnea, tripoding, I'm trying to think of anything else. Nasal flaring. None of that is present. So now we will move on to chest expansion. We'll have you take deep breath in and out. And now the back. The chest expansion is symmetrical, both anteriorly and posteriorly. We will now do percussion. Okay, so percussion, there was resonance to percussion throughout all lung fields. We will now do tactile affirmatives. Every time you feel my hands, if you say 99. 99, 99, 99, 99, 99. Okay. And 99, 99, 99. Okay. So tactile affirmative vibrations were felt equally throughout the whole chest. We'll now move on to auscultating her lung sounds. Take your breath in and out. Okay, and now laterally. Okay. Okay. So no adventitious lung sounds are noted. She's cleared to auscultation bilaterally. We're now going to rule out consolidation by doing first whispered petroliloquy. Every time you want to stethoscope, if you will whisper the word 99. Okay, and now every time you want to stethoscope, we're going to do bronchophony, which is going to be you saying the word 99 every time. 99, 99, 99, 99, 99, 99. Okay, and now we are going to do egophony, which is saying the letter E. E, 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 E. Okay, so no signs of consolidation were noted. So now we will move on to the cardiac part. So to start off, we will do the aortic, pulmonic, Erb's point, tricuspid, mitral, and that was with my diaphragm. We'll now do the bell, aortic, pulmonic, Erb's point, tricuspid, mitral. Okay, S1, S2 were both noted. No murmurs or abnormal heart sounds were noted. We're now going to palpate for the point of maximal intensity. Okay, and it's going to be at the fifth intercostal space, left mid-clavicular border, and we're going to auscultate at that location for apical pulse for 1 minute. And so 1 minute, and now we would have apical pulse of like 65 with a regular rate and rhythm. We will now do this similar, but have you laying flat for us. Okay, so we're going to start off with aortic, pulmonic, Erb's point, tricuspid, mitral. Now the bell, aortic, pulmonic, Erb's point, tricuspid, mitral. No abnormal heart sounds or murmurs. S1, S2 were auscultated. I'm now going to assess for any sort of heaves or lifts, which are not noted. And then I'm going to palpate for any sort of thrills, so aortic, pulmonic, Erb's point, tricuspid, mitral. No thrills are palpable. I'm now going to, so also no jugular vein distension or jugular pulsation noted. The head of it would be at 30 to 45 degrees. Now we're going to do her abdomen, so I'm going to take a look. It's symmetric without any distension. And it's flat. I'm going to now auscultate for her bowel sounds. And her bowel sounds are normal active. I'm now going to auscultate again for breathes with the bell, and this is going to be over the aorta, the renal arteries, iliac arteries, and femoral arteries. Okay, so no breathes were noted. We are now going to percuss. Okay, we percussed tympani to percussion with dullness over some over some solid organs. Now I'm going to palpate. I'm palpating for any masses or tenderness in the right upper quadrant for the liver, left upper quadrant for the spleen. Spleen wasn't palpable, and no masses or tenderness noted. I'm now going to have you sit up and we're going to do CVA tenderness. Okay, any tenderness? So, no CVA tenderness noted. We're now going to assess your joints. So, we will start off with your hands, wrists, elbows, shoulders, hips, knees, ankles, and toes. Okay, so no redness, swelling, deformities, nodules, tenderness, crepitus, or no swelling noticed in any of the joints, and all joints were bilaterally symmetric. We'll now do her fingers, and so start off. Cap refill is less than 3 seconds. Radial pulses is less than 2, or radial pulses are even at 2+. I'm now going to have you do range of motion of your fingers. So flexion, extension, hyperextension, abduction, adduction. And now that was full range of motion of the fingers. I'm going to squeeze my hands. Hand strength was 5 out of 5. I'm going to now have you you do your wrist range of motion, so flexion, extension, hyperextension, ulnar deviation, radial deviation, rotation, full range of motion of that wrist. We'll now do the elbow, so flexion, extension, hyperextension, and then full range of motion of the elbows. I want you to pull with your forearms, there you go, and just push against it. Now pull, there you go. Strength for the triceps and biceps was 5 out of 5 as well. Now we'll do shoulders, so flexion, extension, hyperextension, internal rotation, external rotation, and then circumduction, and then abduction, adduction, and then we'll have you push against resistance, pull, and then shrug. There you go. So full range of motion of the shoulders, crown nerve 11, which is the accessory nerve, is intact, and strength of shoulders is 5 out of 5. We're now going to do a light touch sensation, so I'm going to have you close your eyes. When you feel me touch, just say now. 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 Light touch sensation is intact. We'll now do stereognosis. So I'm going to have you hold your hand out. Can you tell me what I just placed in your hand? Paperclip. Okay, so stereognosis is intact. We'll now do grasthesia. Can you hold up number 8? Perfect. So grasthesia is intact. We'll now do vibratory sensation. And I'm going to have you close your eyes. Perfect. So vibratory sensation is intact. We'll now do cerebellar coordination, and to do that, I'm going to first have you finger to finger. There you go. Okay, and on the other side. Okay, and then finger opposition, and then rapid alternating movements. Perfect. So cerebellar coordination is intact. We'll now do deep tendon reflexes. So to start off, I'm going to have this arm, and I'm going to do the brachial radialis. Okay, and then we're going to do the biceps. Okay. Okay, and then we're going to do triceps. Okay, and on the other side. Okay, and then we're going to do the patellar. Okay, and then we'll do the Achilles. Okay, and then Babinski. Okay, so deep tendon reflexes are intact bilaterally. We are now going to do capillary default of the toes. It was less than 3 seconds. We'll now do dorsalis pedis pulses, posterior tibial pulses. Both are 2 plus and equal bilaterally. We'll now do toe range of motion, so flexion, extension, hyperextension, abduction, adduction. Full range of motion of the toes. Her ankles, we'll do plantar flexion, dorsiflexion, and this is for her ankles. Internal rotation, external rotation, circumduction, perfect. So full range of motion of her ankles are noted. We are now going to do her knees. We're going to do strength of her knees. So if you pull, let's see, pull against my arms, push, okay. Strength is 5 out of 5 for her knees. And so now we're going to do your hips. If you can pull your legs straight, there you go. Push against resistance, pull. Same side, push, pull. 5 out of 5 strength for her hips. We will now do, we'll have you stand up, and we're going to do range of motion of your knees. So first is flexion, extension, hyperextension, flexion, extension, hyperextension, and then so that is for range of motion of the knees. Now we'll do, that's full range of motion. So we'll do now the hips, and that's going to be like flexion, extension, hyperextension, and then circumduction, abduction, adduction, inversion, eversion. Now the same side, flexion, extension, hyperextension, circumduction, abduction, adduction, inversion, eversion. Full range of motion of the hips. We will now do we did knees, hips. Now we'll do spine. So I'll have you lean forward for me, and she's in flexion with her spine. S curve, and now that's extension. The S curve was noted when she was in flexion. Her spine's midline is aligned. There's no signs or symptoms of scoliosis. There was no tenderness. So now we're flexion, extension, and now we're going to lean back, hyperextension, and then lateral flexion, and then rotation. Perfect. So full range of motion of the spine. Now we will do Romberg. So if you will, stand right here and then kind of have your legs, arms over your side, close your eyes. She doesn't lose balance when her eyes close, so Romberg test negative. We will now have you take 3 or 4 steps that way. That's regular gait. Now come back, heel to toe. So regular gait had symmetric stride length and was steady. Tandem gait was heel to toe, constant contact. So she passes both of those. Now if you can hop on one leg, now hop on the other leg. Perfect, and we're done.